lasts for longer, for up to 12 months. Now, we cannot establish whether a vaccine can last for longer unless the vaccine has existed for longer. So because these vaccines are so new, we only started to get trial data for the AstraZeneca vaccine in September last year. And our expiration date, that's April, probably means that these vaccines, the batch that we got was probably manufactured in November last year, 6 months before the expiration date. But each month that goes on, the company runs new laboratory tests to see if a vaccine that was produced 6 months ago, if it would remain stable for a longer period. And we need to do that as the time moves on. So each month, a COVID vaccine company would run a test and see if it remains stable. It would be a similar test to, for instance, if you test what would happen if you don't store it at the right temperature, what happens to the vaccine. So in this case, it is entirely possible that the AstraZeneca vaccine could remain stable for beyond 6 months. So in our case, beyond April. However, there was a press briefing by the health minister yesterday, and he explained that if we were going to use AstraZeneca in our original vaccine rollout strategy, so not the new one that was announced, the original one, we would have used all the vaccines by April. And I assume he said that because we would probably have used all the 1 million vaccines for first doses. You require a second dose 3 months after the first dose, that we would have used the new ones coming in for second doses. But he also said they have now spoken to the Serum Institute in India, where our vaccines were manufactured, and they've asked that should we use these vaccines in the second vaccine rollout. We don't yet know if we will use AstraZeneca vaccines, but should we do that, we will ask if we could exchange the batch. They're already speaking to the Serum Institute, but he gave the assurance that he will not be using vaccines from AstraZeneca at this stage that have an expiry date of April, even though it's possible that it could be pushed forward. We don't know because we haven't seen those data yet.
Yes, obviously there are unknowns, Mia, at this point in time. But I've also read of a report with South Africa saying that they could possibly consider selling the unused AstraZeneca vaccines.
So the health minister yesterday said that he has had many emails from governments from other countries who have asked if they could buy this batch and use it in their own countries. It would obviously be countries where the variant that was identified in South Africa isn't circulating, because that's the whole issue in South Africa, that this vaccine doesn't seem to respond well to the variant and provide good protection. Important to point out, only against mild to moderate COVID do we know that it doesn't provide good protection. We don't yet know what will happen with severe disease. And the reason why we want to know about severe disease is because that's the type of COVID that makes people end up in hospital and makes them die. So we want to prevent that specific form of COVID more actually than we want to prevent mild to moderate COVID, because we want to keep people out of the hospitals and we don't want people to die. It has an impact on the economy, and it obviously has a lot of trauma that goes along with it. But yes, there are other countries that have contacted them. He hasn't made a decision on whether it would be sold, because we have a scientific committee meeting this week who will tell us, will we use the AstraZeneca vaccines in our second rollout? And if we will, it would obviously make sense to sell it.
Well, obviously, but also I think one important issue is looking at South Africa and where we are. And I'm sure we have got the technology, we've got the knowledge, we've got the expertise to basically develop a local vaccine for local conditions. And this is something that I know that the health minister believes it can be done. It can be done in this country.
We actually don't have the expertise. It's actually a misconception that people have. To be able to develop any kind of vaccine, the technology that you need for that takes literally years to develop. So we have one company in South Africa called BioVac who has done filling and packing of vaccines. They've never developed a vaccine. So that is something that takes a lot more effort than what it sounds like. We do have another company, Aspen, as you may have heard, who will help with COVID vaccines. They won't be manufacturing it. They will just be filling and packing the Johnson & Johnson vaccine. So in other words, the vaccine already in its made form will arrive in South Africa, and they will just put it in vials and in boxes and label it and then ship it to countries.
Yes. Now, obviously, at this point in time, we're talking about AstraZeneca, we're talking about Johnson and Johnson, but we know about vaccines that are obviously that have been developed and are being used in countries like China, and looking at the Sputnik V vaccine that has been developed in Russia as well, and South Africa being part of BRICS. And we've got this close relationship with countries like China and Russia as well. What are the opportunities there to obtain a vaccine from these countries?
So maybe go back a little bit. I'll get to what are the opportunities from there. Just a bit of background. So our adjusted vaccine rollout strategy will now look different from the first one. And what will be the big difference is that we will phase it in as part of an implementation study. So that is a study that will use products that have already been proven safe to use and effective, and we will roll it on in a way and monitor it to see how well it works on our variant, essentially. And we're very interested to see how it works against preventing severe disease. Now, if we get, at the moment, we know of two vaccines that we will use for this implementation study. It's Johnson & Johnson and it's Pfizer. We're waiting to hear if AstraZeneca will also be part of it. And we will then compare these vaccines to see which ones, how well they compare working on the variant preventing severe disease against each other. The health minister has mentioned twice, 2 or 3 times already, that we are in talks with Russia for the Sputnik vaccine, and we're also in talks with a company in China called Sinopharm for their vaccine. Now, we've got a very, very really good medicine regulatory body in our country who wouldn't allow medicine of any kind to come in if we don't have peer-reviewed data or good data from phase 3 trials. So that is the latest stage in clinical trials, a large clinical trial. Now, the issue up until recently with Russia and China, Sinopharm, was that we've seen data in press releases, but we haven't seen peer-reviewed data, and all the data, haven't been released. That has changed with Russia. They have published peer-reviewed data, which showed good protection, good data, from their vaccine. However, we don't know how it will work on the variant. So we will probably start phasing it in, test it, and do it with relatively small amounts of it. With Sinopharm, we have not seen peer-reviewed data. So we cannot procure Sinopharm yet because our medicine regulator won't approve use of it. If we don't have good data, we're waiting for that data to become available.
Yes. Now, Mia, obviously, we've had some sort of a plan. We've had some sort of a strategy as far as vaccine rollout is concerned. And against the background of what has happened with this vaccine that has come out from India, and now we are talking of certain dynamics that are changing as far as the vaccine rollout is concerned. How is this likely to impact on the plan that we've had? And more so, I think, looking at containing the virus, because this is the longer this takes, obviously, the more complicated the issue will arise in terms of containment.
So, as I've mentioned, we will now start slightly slower, than we would have started, because we're going to start with a lower amount of vaccines and use it as part of an implementation study. So yesterday, the health minister said that we are likely to get some Johnson & Johnson vaccines into the country, because we don't have any yet, by next week, he's hoping for. And it won't be many vaccines. I see Business Day this morning reported it will be 80,000 of those vaccines. Remember, the big difference between Johnson & Johnson and other vaccines for South Africa is that we have data on Johnson & Johnson that shows us that it is effective against preventing severe disease caused by the variant. It's about 85% effective. We don't have any data like that for another vaccine. We've got Novavax data, for other forms, less severe forms of COVID, but we are very interested at the moment to see severe COVID. So the other difference with Johnson & Johnson for the entire world is that so far from the vaccines that we have data for, this is the only vaccine that requires only one shot, which makes it a lot easier to administer, because it's very hard to go and follow up with everyone who's had a shot to make sure they get their second shot. It always happens that you lose a few people along the way. So with Johnson & Johnson, you don't run that risk. So what's now going to happen when the Johnson & Johnson vaccines arrive, those vaccines will be used as part of the implementation study. And because we do not have approval yet for use of Johnson & Johnson in the country, they will be using it as part of a clinical trial, because it's a lot easier to get approval to use a drug as part of a clinical trial than to get approval for general use. It takes a lot longer to do that. Johnson & Johnson has a rolling application for that, and according to their principal investigator, Glenda Gray, it will take about 3 months for that application to be concluded. So at the moment, we will only be able to use it as part of a research setting, because that's the kind of approval that they will get from SAPRA, our medicine regulator.
Well, Mia, thank you very much for that and for your time with us this morning here on News and Views. We wish you all the best. Take care.
Thank you very much.
Mia Malan joining us this morning, and she is the deputy, in fact, she's the founding editor-in-chief of Bhekisisa. Mia Malan with Bhekisisa this morning. Very, very interesting discussion. We're going to head for the news. I know we are running late, but we'll be back.